Hello, my name's Andrew, and I'm going to be your student physical therapist today.
Okay.
Um, Today, what I would like to do is conduct a short interview with you, just so I can get a little bit of an idea on your condition. Is it okay if we go ahead and proceed with that?
Yes.
All right, so first, can I have your name?
Chelsea Varble.
All right, and date of birth?
10/14/1960.
Okay. And I saw on your chart that you had a stroke on the right side of your brain 1 week ago. So I wanted to tell me just kind of what happened and what you remember leading up to your visit to the hospital.
So what I can remember is I was outside working in the garden just like any other day, and all of a sudden I was having a bad headache, and I was having some weakness in the left side of my body, specifically my arm, and I couldn't hold up my supplies anymore, and I tried calling for help and my words were slurring. So my husband took me to the hospital really quickly after that.
All right, and after you were taken to the hospital, what kind of treatment did you get?
So everything moved pretty quickly once we got there, but they took me right in through the emergency room, and they took me to get a CT scan of my brain, and they were checking for a bleed is what they kept telling me, and thankfully there was not one. So after the scan, they gave me some medicine to help with the clotting that was happening.
All right, thank you. Can you tell me about any symptoms that you've been experiencing since the onset of the stroke?
So ever since then, it's been hard for me to use the left side of my body. Still have some weakness there, and I was having to work with speech therapy with speaking.
All right, and I remember you saying you were out gardening when this happened.
Mm-hmm.
So I was just wondering, before the stroke, what kind of activities did you like to do?
Yeah, so I'm pretty independent. I would garden on my own, go grocery shopping on my own, out to dinner, sports with friends, that kind of thing.
Mm-hmm. Yes, and where did you work beforehand?
I was a nurse.
Okay. And do you currently have anything that you're using right now to help you move around? Like a wheelchair or a cane or a walker or anything like that?
Yeah, so I've been using a cane ever since the stroke. Before then, I didn't have any equipment that I used to get around.
Can you think of anything else?
Mm-mm.
Okay. And since the stroke, have you recently had any falls within the past 6 months or so?
Thankfully, no falls.
Okay. And I just wanted to be sure you are aware of the definition of a fall. So a fall is whenever you kind of have an uncontrolled loss of kind of height. So you uncontrollably go from a higher surface to a lower surface.
Gotcha, yeah. Haven't had that.
Okay. Mm-hmm. And within the past year?
Mm-mm.
Okay. Now, I just want to know, have you had any past or present illness outside of the stroke, or any other injuries that have taken place within your lifetime that I should be aware of?
So I've been diagnosed with hypertension for a couple years now. So I've been taking some medication for that, and they say that that could have led to the stroke.
And you said you were on medication for your blood pressure. Just want to know what medicine that you are on for it.
So I've been taking lisinopril tablets. I take it twice a day.
Okay, thank you.
Mm-hmm.
And now I just want to know kind of about your home environment and what you might be going back to. So first, when you do return home, do you have somebody there to take care of you, whether it's family or somebody from within the community?
Yes, my husband and I, so he'll be taking care of me, and then I have family coming into town. Our children are coming too to help.
Mm-hmm. that's good. When you're when it's just you and your husband around, and no family in town, is there ever any time that you're alone, and maybe not have anybody else around to help?
There will be a few hours a day. He's still working part time, so a few hours I will be alone during the day.
All right. And can you explain the layout of your house for me? So like, are the doorways big enough for you to get into? What's your bathroom set up like? Do you have any stairs within the house? Just kind of give me an idea of how the house is laid out.
Yeah, so we live in a one-story house, so no, no big staircase. There are like 3 or 4 steps leading to like the front of the house and the back of the house. Our doorways are standard, but since I just have to use the cane, that's been fine, or that will be fine, I'm sure. And our bathrooms have actually been renovated to have like the bars in them, and the tub was taken out to where it's a walk-in shower to help prevent falls too.
Okay. And now I just want to know if there are any goals that you would like to get out of therapy. Just kind of what you would like to get back to, and maybe some things that we could possibly work on down the road.
Yeah, so like I was saying earlier, my left side still feels pretty weak. So just getting strength back on that side or mashing it to the right. And then just doing what I used to do beforehand. If I can get back to that, that would be wonderful.
Okay. And as we wrap up the interview, I just want to know if there's anything else that you think I should know before moving forward.
I don't think so.
Okay. Well, thank you for your time.
Thank you so much.
Look forward to working with you.